Well, good afternoon, everyone. This is a very difficult time for all of us. It's a challenge that nobody's ever seen before. And, two of the things that I've been hearing are, first, that people have a lot of questions about what the law school is doing, what the health concerns are. And second, that they're feeling kind of apart from the community that matters to them so much. So, we're thinking through different ways to respond to that. And one of them is I'm going to be having information sessions twice a week that are going to be focusing in on different questions that are on people's mind. And again, it's really partly to provide answers to questions, and it's partly to bring us all together. So today we're going to be talking to Professor Larry Gostin, who's one of the preeminent experts on pandemics and on the coronavirus. And we're going to be focusing on health issues. And then on Friday, we're going to be having Dean Ohm, Dean Balin, and Professor Sunder, and they're going to be talking about questions about, the questions that I know are very much on students' minds of, how you do well in an online environment, how you do well personally, and how you overcome all the challenges. So before we get into our first session, though, let me just say a word of gratitude for everyone in the community. I have just been so impressed by the way people have pulled together at a really difficult time. The staff and administration, who have worked so hard and so creatively, to keep the campus running and to keep the classes going, to do everything to keep the members of this community healthy and safe. And I'm so grateful to you. I mean, the faculty, it's amazing to me. We've had 400 courses online. We've never done anything like that, and we're in the midst of our second week, and it hasn't been easy, but it's really gone extraordinarily well. So I'm grateful to the staff and administration, the faculty, and I'm really grateful to the students. I know how hard this has been. So many of you have emailed me and written me about the challenges that you're facing, and I have to say I admire you and admire the way you're focused in on the issues that matter. And the support that I'm hearing from our students for other members of the community. So let me begin. We're going to get through this together. It's not going to be an easy time, but we're going to get through this together because we're a community. So I want to start by expressing my gratitude. So now we're going to focus in on some health issues with Professor Gostin. I've gotten about 40 questions in advance of this session. Some of them are about health. Some of them are about a range of academic issues, ranging from, withdrawals to the length of finals period to the faculty's decision on pass-fail. We'll be talking about those on Friday. Today, we're going to be focusing in on health questions. And again, we are so lucky to have as a member of our community, Professor Gostin, who is just preeminent. So thank you very much, Professor Gostin.
Thank you, Dean.
So, let me start with a question that I think is probably top of mind to everyone. Kind of where are we in the path of this disease? Is this, when do you think we'll be looking at kind of the apex? When will we know that it's starting to abate?
Yeah, well, one of the things that is important, and I think our political leaders, even our president, hasn't really conveyed this very clearly, is that epidemics are not static in time, and they're not static in one place. And so they move. And so it's fairly clear, as Governor Cuomo said, that in New York State, and particularly New York City, the COVID pandemic is going to peak probably in the next 2 or 3 weeks. In other parts of the country, they might be just beginning to emerge on an upward path. And in Washington, we're not quite sure yet. The final thing I would say is that while epidemics aren't static, this particular epidemic is really, really hard to track in the United States, particularly since we've done so little testing and we've waited for testing for such a long period of time. So now we're probably seeing community transmission in various pockets across America, We don't know what the foothold is or what the trajectory is. That's why I think it's not wise for our political leaders to say, well, at point X, whether it's Easter or at certain point in time, it'll be over and we'll go back to work. So I think it'll depend upon where we are. And also a lot of experts are talking now about a segmented approach. And the segmented approach doesn't have a lot of clarity yet, but it's something like this, that if we want to get America back moving again, we need to do it in layers. And so, for example, if somebody's young and they have COVID antibodies in their bloodstream, it means they've had the disease, they're most likely immune, they can go back to work, or they can go to their elderly parents and bring them food and look after them. And then as we get further, there may be others who can join the workforce. And so I think we're going to have to take a sophisticated, layered approach to kind of getting us back to work. Most of the data tell us that if you lift fairly aggressive physical distancing too soon, you could have a resurgence. That's what's happened in Hong Kong. It happened during the 1918 flu pandemic. And so you don't want to ease restrictions too soon, and when you do it intelligently, in a layered way, incrementally, and be ready to snap back if you need to.
Sorry.
Can you hear me?
Yeah, now, yeah.
Oh, right, okay.
How can you tell when it's time to start easing the restrictions? What are the signs?
Right, I've been writing about that. I think the signs are as follows. One, is there a verifiable significant reduction in cases? We saw that in China, and we had a pretty good sense of it because they did so much testing. And so basically, it's verifiable under two conditions. One is that we're doing a lot of testing, including random testing in the community, and can see that the case counts are going down. And second, we need a stable downward trajectory. We should not take day-to-day case counts as any indication. And then secondly, the second criteria I've thought was very important was, are we well within our health system capacities? That is, do hospitals for now and the foreseeable future have enough trained medical staff, nursing, protective equipment for doctors and nurses? Is there enough supplies of ventilators, masks, gowns, essential medicines, things like that? And so if you've got a verifiable downward trend and you have the health system coping very well, then I think incremental, evidence-based return to normal with the ability to snap back seems most sensible to me.
So when we start classes, will we have social distancing in the classroom?
Well, that's a very good question, and I don't want to predict what Washington's going to look like in September. There have been various predictions about how long this is go. I mean, I've seen some very thoughtful professionals think that that we may not be ready to relax social distancing by then, but I hope we will, and we will begin class. If we do, it will depend very much about where we are in Washington with the epidemic. If the cases are negligible and we've got a good handle on them and trying to contain them, we might be able to go back as of normal. But it'll have to be a new normal, and the new normal will be a lot of the the behavioral habits we've had in the past will have to change. So a lot of hand washing. I think all the actions you've taken, Dean Trainer, will need to continue in terms of sanitizer in the hallways, signs in the bathrooms about washing your hands, being really rigorous, not hugging or handshaking. But whether or not we'll have to actually distance people in class, probably not if we're in a good place. The only ones we need to think about carefully about distancing, and I do think we should even then, are those in vulnerable risk groups. We don't have many older people, although we have some in our class, but we do have people with, asthma, bronchitis, diabetes, heart disease, things like that. Pregnant women, those we're going to have to take special precautions for, I think. And of course, you've assembled a great team, and I'm sure the best decision will be made.
We have, we're very focused on this. We have a team the university team meets every morning at 8 o'clock. My team meets at 9 o'clock in the morning. Actually there's a university leadership meeting, which I'm have another representative at today because I'm doing this session, but that's at 4 o'clock. Very much focused, and we're looking day to day. Everything changes day to day.
It really does.
About how we move forward.
Mm-hmm.
So that's the big picture.
Yeah.
So a couple questions that people have sent in that are kind of more specific.
Mm-hmm.
Can you transmit the disease if you're asymptomatic?
Well, we don't have a definite answer to that, but most of us are assuming you can. So the answer is, the best answer is yes, you can, and you should assume that you can.
And then from the time of your encounter with somebody with the disease, and 14 days is the quarantine period, does it always manifest itself on the 14th day, or is it earlier? When does it normally manifest itself?
Oh no, 14 days is the outer limit. It should normally manifest itself in about 5 days. Mm-hmm. So we take the outer limit of 14 days just so we can be on the side of caution. Mm-hmm. But you'd rarely be asymptomatic for 10, 11 days, and then on the 14th day get sick. That would be very odd. That would be odd.
Okay. I mean, I think that's helpful because I think one thing that people think is it just, the 14th day is it manifests itself.
No.
But it's in fact, the 14th day is that's the arc.
That's the outer limit. Yeah.
Okay. Now, and so this is the third time you've talked to the community. What have we learned new about kind of the way in which it's transmitted? So part of it is through what do we know now about how it's transmitted?
It's troubling to me that we still know so little about it, because we've been so busy trying to mitigate what has become a national crisis that we're really not studying it from an epidemiological point of view. And that's really, that troubles a lot of us. So we don't know a lot more, but this is what we know. We know it's respiratory. And we know that unlike, say, in other kinds of diseases, it's not highly aerosolized, so it doesn't hang in the air for a long time, but it can hang in the air for an hour or even 2. But mostly, most people are being infected by being in close contact with someone who has it. And we are seeing, and this was very interesting to me, that the major clusters of cases aren't taking place at universities or workplaces. They're actually taking place in households. And so households tend to be a big risk. And so that's why you should be very careful with your flatmate or your family members. The other thing about it is that it's droplets. So if you're not within 6 feet of somebody, the chances that they'll sneeze and the droplets will go on you. When somebody sneezes, there could be thousands of droplets, so it's dangerous. So, but if you're 6 feet away, you're pretty safe. Um, the big thing we don't know is about surfaces. There have been studies that find live virus on surfaces, and depending upon what the surface is, plastic seems to be the longest, cardboard for a few hours, things like that. Some for a couple of days, like plastic. So they seem to be on surfaces, which is why we recommend that you disinfect surfaces. But it's unclear yet how many people or how efficiently you can contract the virus by touching a surface. Of course, the best public health advice is don't touch surfaces that have been touched by others.
So let's say you have a roommate. How do you keep yourself safe? You don't know if that person's not manifesting any symptoms.
You
What
know,
kind of things do you do?
well, it depends, So with, say, my wife, Jean, and I, we're pretty much here by ourselves. And so when we're in our own household, we tend to, you know, have near normal interactions with one another. But if you're certainly if your household companion is out and about, then you'll have to be much safer and just try to keep a safe distance. But what's very, very clear is that if your household member exhibits any flu-like symptoms, any cold symptoms, things like trouble breathing, sneezing, elevated fever, then you need to be really rigorous. And in those cases, you should not share, if you can, if it's possible, you should not share the same room or be in the same room. You should not share utensils. You should not touch common spaces. When you bring that person food, leave it at the door and then leave. And you need to do that for 2 weeks. Now that seems extreme, but that's the biggest risk in household settings. And if somebody is actually actively symptomatic, that would be the wisest course.
And then, so let's say somebody's symptomatic and you share a bathroom. How can you keep the bathroom? What do you do?
Okay, that's a very practical question. So what you should do is, first of all, as best you can, disinfect the bathroom and also wash your hands. But beyond that, when you're in the bathroom, don't touch common surfaces. If you have to, then make sure you don't touch your face and rigorously wash your hand afterward. I wouldn't share the same towel. In fact, I wouldn't use a towel at all. I would use a paper towel. And with that paper towel, I would open and close the tap with the towel. I would get the soap using the towel and not touch the soap dispenser. And then I would wash up and use the towel to dry, discard it. Oh no, not discard it. I would use the towel to open the door, then discard it. And so you get the idea. Don't touch surfaces that the sick person has touched.
And then how do you, and again, I'm being very granular, but these are
Yeah,
issues that really matter.
yeah, these are
Um,
the details, yeah.
yeah, and how do you disinfect? If you don't have wipes, how do you disinfect like the kitchen counter,
Um,
some sort of,
use a bleach and water solution. You can go to CDC website, it'll tell you exactly what solution, or just use the antibacterial spray, the antimicrobial spray would be the best way to do it. And remember, don't do it with a sponge or even a cloth. You're better off doing it with a paper towel and then discarding the paper towel.
okay. Another person wrote in Can you walk outside? Can you run outside?
Yes, you don't want to run if it's in a crowded place. So for example, I've been running and walking on the canal because I'm near the canal. Um, but if I see a lot of cars on the canal on a weekend and a lot of people there, I tend to just turn around. And so you just have to use your common sense. So and even when Jean and I walk in the neighborhood, and we see other people walking, we will go on the other side of the street. When say hi,
Mhm.
smile, ask them how they're feeling and how they're doing. So in other words, getting outside is highly recommended for your physical and mental health. You're as safe outside as you can be anywhere, as long as you're not in a crowd or not within 6 feet of any person.
Okay. Um, so do face shields, gloves work? And should I wear kitchen gloves to the grocery store? So two people asked similar questions.
Okay, well, they're different things. So, face shields, I wouldn't put on. They're like masks, and people are not suggesting you do that. Um, uh, Gloves, certainly can protect you a little bit, and if you're outside. When you go to the supermarket, it's probably wise to use disposable gloves. But remember, when you're using the disposable gloves, they can get contaminated. So you don't want to touch your face when you've got them on. And so when you come back from the supermarket, you take the gloves off, you discard them, and then you wash thoroughly, and then you're fine.
So one question is,
And
what?
also, when you're in the supermarket, stay away from people, including the checkout person, other customers, things like that.
So is it better to use self-checkout if you can?
I do, yes, but then you have to touch the buttons, and you got to try to avoid that. So, but if you have to touch the buttons, just again, make sure that you don't touch your face before you wash your hands, disinfect your hands. Bring Purell with you and just do it right after you've touched the buttons.
So somebody writes, is there any special reason why CDC does not recommend wearing facial masks?
Yes, there are. So facial masks are probably, uh, uh, unless you've got an N95 mask and you're trained to use them and fit them, probably won't protect you from getting infected because they're not well fitted. When you take them off, you can contaminate yourself. People just don't know how to use them. The second reason is that we have a shortage of masks, and we don't want people to use masks when they're not necessary because we want them for health workers. There are data to suggest that if you're symptomatic and you want to prevent others from contracting your infection, that you're better off wearing a mask. So right now we're telling people who are symptomatic not go near anybody, so there's no need for a mask. But if somebody who was symptomatic was wearing a mask, it would reduce the risk to others.
So another question is, where is DC conducting COVID testing? Are there any, how do you qualify to be tested?
That's one of the really sad gray areas. You just feel like, the president and or others keep telling you, the check's in the mail and that, the testing is going to be here. You can get it. So there is no clear way of doing that. And I'm not there are other cities that have enough test kits that are, and certainly they've done this overseas, to have drive-by test kits or things like that. You don't want to set up a testing center where people come and congregate and get tested. That wouldn't be a good idea because you need to separate. But the best way to get a test is to talk to your doctor. And your doctor should be able to order a test. But CDC's guidance to physicians is only to order the test if the person has symptoms consistent with COVID and that other causes of those symptoms are not ruled out. In those cases, you should be tested.
Okay. Do you know, does our Georgetown student health insurance cover the test? Do you know?
I don't know for sure, but I would be shocked if it didn't. And I think in some of the legislation we've seen that there has been either a request or a demand for health insurers to cover testing for free. So I think that testing should not pose any financial burden. If it does, I'd like to know about it.
Okay. So if anybody has a financial burden because of the test, email me,
Yes,
and
please.
right,
And then we should look into it.
and we'll look into it. And I will also follow up
Yeah,
on that.
yeah.
Um, so if you get exposed, does testing negative mean you'll not test positive in the future? Is there a gap between when you're exposed and when you test positive?
No, it doesn't mean that at all. I mean, the problem, I won't get into the details, but testing, um, test, t- te- tests are reliable based upon two functions. Are they sensitive? That is, do they reliably, 99% pick up infections, and are they specific? That is, do you get a lot of false positives? This one, is somewhat accurate, but if it, in the early stages of the illness, it may not pick it up. So the fact that you test negative doesn't mean you've got the all clear. You still, if you have reason to believe you may have it, probably do have to self-isolate for 2 weeks.
Okay. And actually, we've just
we're trying to get an antibody test that will give us a better idea. That'll be a very, very, very good thing, because with an antibody test, we can find out if somebody's had COVID infection. And if they have, we assume that they'll be immune. And if they're immune, we can then use them in the workplace, in educational, in nursing homes, in their families. They can be our kind of really go-to people. And the more people that get infected and the more people are immune, and if we can detect them reliably, that's the best way for us to get back to work and back to school.
Okay. And actually we've received one of the questions says that the district is aiming to open a number of testing sites, including drive-through and drive-up options in the coming days. And a site for children is already open at Children's National Hospital, and others are planned at Sibley,
Yeah.
United Medical Hospital.
We just need to make sure that we don't make the mistake of going in for testing and being in a waiting room with other people.
Right.
That would be a really serious mistake. We have to make sure that we really distance people who are getting tested, because presumably if you're being tested, you're at elevated risk, and you want to make sure that you don't spread the infection inadvertently by testing.
So, I mean, one of the things that you've recommended in the past is that when you think you might have the virus, what you do first step is you call your doctor, call your primary care physician.
Yeah, that's right. And you might not even need to do that. I mean, a lot of things that CDC is just saying, if you think you might be ill or might be exposed, if you're well enough and you can completely separate yourself and self-isolate, you may not even need to. But yes, it's never a bad idea to call your physician, and definitely don't, just show up in an emergency room or in a crowded doctor's office. That would be socially irresponsible.
Okay, one question: can your pets contract or spread the virus?
There was a case, a documented case, I think in Hong Kong, where the pet did get the virus, and pets have contracted SARS and other kinds of coronaviruses, but there's no evidence to date that you can contract the infection, or anyone can contract the infection from your pet. So if the pet caught it from you, obviously you'll be then immune, but the pet can't then give it to another family member. We have no evidence that that's the case.
Okay. All right. So we're trying to keep these to half an hour so they're succinct for people.
Sure, of course.
Any closing thoughts that you want? So we also, one thing I want to urge people is, as this evolves, go to our website, the FAQ, and we constantly are updating that. So that will give you a sense of exactly what's going on. Yesterday, we had one of our adjunct was tested positive, and so we reported that. But again, if you look at our website, that will kind of tell you what's going on. Any closing thoughts?
Yeah, I mean, my closing thoughts are this. I mean, it's one of optimism, in the sense that, we're going to get through this. It's actually, it's something we are going to get through. Hopefully we're going to get through it stronger and come together as a nation, and as a Georgetown community. And then, treatments will be down the line in the next couple of months. That doesn't, I don't think they'll be a game changer, but a vaccine will eventually come, and it'll be highly safe and highly effective. And so that, it's odd to me, and it must be odd to everyone, that we're actually using the same tools to combat COVID here in 2020 that we did in 1918, or in the slaughterhouse cases, in the late 19th century, or even in the colonial period. Nothing has changed. But the one thing we do have is a great NIH, a great scientific community. And so at the end of the day, we're all, we're going to make it through together as a community.
Very good. I mean, and that's actually exactly the right note to end on. And I want to thank you very much for sharing your insights and your knowledge. You are, a world-renowned expert. We're so fortunate to have you in the community.
Well, thanks. Thank you very much, Dean Trainer. It's, you're like a holding environment for Georgetown. We have a great community that's really sticking together, and it's just beautiful to see.
And that's absolutely right. We have a great community. It's extraordinary to see this. It's a difficult time. I know how painful this is for the entire community, but we are banding together, and we will get through this together. So thank you all, and we'll be back on Friday. Take care. And thank you again.
Bye.